Under Part 1, Understanding Peptic Ulcer Disease, PUD, Causes, Symptoms, and Treatment. What is peptic ulcer disease, P? Peptic ulcer disease is a condition in which sores or ulcers form on the inner lining of the stomach, gastric ulcer, or the upper part of the small intestine, duodenal ulcer. These ulcers occur when the protective lining of the digestive system is damaged by stomach acid or an infection, most commonly caused by Helicobacter pylori, H.Pylori bacteria. Causes of PUD. 1. H. pylori infection. This bacteria weakens the stomach's mucosal lining, allowing stomach acids to create sores. 2. Excessive use of NSAIDs. Painkillers like aspirin or ibuprofen can damage the stomach lining by blocking substances that protect it. 3. Smoking and alcohol. Both increase stomach acid production and weaken the stomach's lining. 4. Stress. While not a direct cause, severe stress can worsen symptoms by increasing stomach acid. 5. Dietary factors. Spicy, fried, and acidic foods can irritate existing ulcers. Long gaps between meals, empty stomachs, can lead to increased acid production. 1. Abdominal pain usually occurs in the upper abdomen, epigastric region. Burning or gnawing sensation that may improve after eating or taking antacids. 2. Bloating and fullness, even after eating small amounts. 3. Heartburn or acid reflux, a burning sensation in the chest or throat caused by stomach acid traveling up into the esophagus. 4. Nausea or vomiting. Sometimes blood-streaked vomit is a sign of a bleeding ulcer. 5. Dark stools. Indicates bleeding in the stomach or intestines. Diagnosis of PU. 1. Blood tests. Check for infection, inflammation, high WBC count, and H. pylori antibodies. 2. Stool test to identify H. pylori bacteria and blood in stool. 3. Endoscopy. A camera is used to visualize and confirm the presence of ulcers in the stomach or intestines. 4. Urea breath test identifies H. pylori infection. Treatment of P. 1. Medications. A. Proton pump inhibitors, PPIs. Purpose. Block acid production, allowing ulcers to heal. Example, Captolanix 60 mg. Dosage: take 1 capsule in the morning before breakfast. Side effects: common, headache, diarrhea, or mild nausea. Rare, risk of nutrient deficiencies like vitamin B12 over long-term use. B. Antibiotics for H. pylori. Purpose: kill the bacteria causing the ulcer. Example, Helicokit, combination of amoxicillin, clarithromycin, and a PPI. Dosage: take 1 complete pack morning and evening for 14 days. Side effects: common, nausea, diarrhea. Rare, allergic reactions, rash, swelling. C. Antacids and mucosal protectants. Purpose: neutralize stomach acid or form a protective barrier over ulcers. Examples: Sur Antacid Plus or Sur Ulfate. Dosage: take 2 teaspoons after meals thrice daily. Side effects: overuse may cause constipation or, rarely, kidney issues due to aluminum buildup. 2. Dietary and lifestyle management. Avoid triggers: spicy foods, caffeine, alcohol, and NSAIDs. Frequent small meals reduces stress on the digestive system. Quit smoking and drinking. Both directly harm the stomach lining and worsen ulcers. Complications of untreated PED. 1. Bleeding ulcers. Blood loss can cause anemia, dark stools, or vomiting blood. 2. Perforation, when an ulcer penetrates through the stomach wall, causing severe abdominal pain and life-threatening infection. 3. Obstruction. Scarring can block food from passing into the intestines, causing nausea and weight loss. Would you like me to proceed with Part 2, IBS symptoms and treatment? Part 2, Understanding and treating irritable bowel syndrome, IBS. What is irritable bowel syndrome, IBS? IBS is a chronic disorder affecting the large intestine. It is characterized by recurring abdominal pain, bloating, and altered bowel habits such as diarrhea or constipation. IBS does not cause permanent damage to the intestine, but significantly impacts the quality of life. Causes of IBS. The exact cause of IBS is not well understood, but the following factors may contribute. 1. Abnormal gut motility. Irregular contractions of the intestinal muscles can lead to diarrhea or constipation. 2. Visceral hypersensitivity. Increased sensitivity in the intestinal nerves, leading to pain or discomfort. 3. Gut-brain axis dysregulation. Poor communication between the brain and the digestive tract can trigger symptoms. 4. Food sensitivities. Trigger foods such as fatty foods, dairy, or gluten can worsen symptoms. 5. Stress. Stress exacerbates IBS symptoms, possibly by altering gut-brain communication. 6. Hormonal changes. Women may experience worse symptoms during menstruation due to hormonal fluctuations. Symptoms of IBS. IBS symptoms can vary but generally include 1. Abdominal pain and cramping. Typically occurs after meals and is relieved after passing stool. Pain is often in the lower abdomen but can radiate. 2. Changes in bowel habits. IBS with diarrhea, IBS-D, frequent loose stools. IBS with constipation, IBLE, hard infrequent stools. Mixed IBS, IBS-M, alternating between diarrhea and constipation. 3. Bloating and gas. Excessive gas production leads to a feeling of fullness and distension. 4. Mucus in stool. White or clear mucus may be present. 5. Fatigue and difficulty sleeping. Secondary to discomfort and interrupted routines. Diagnosis of IBS. 1. Clinical criteria. Rome 4 criteria. IBS is diagnosed when symptoms occur at least 1 day per week for 3 months, associated with changes in stool form or frequency. 2. Exclusion of other conditions. Blood tests. CBC, thyroid function to rule out anemia or other conditions. Stool tests to exclude infection or inflammatory diseases like Crohn's. Colonoscopy if symptoms like blood in stool or significant weight loss are present. Treatment of IBS. Treatment is personalized, addressing symptom relief and improving quality of life. 1. Medications. A. Antispasmodics. Purpose: reduce abdominal cramps and spasms. Example: Tab-Rostil 135 mg. Dosage: 1 tablet 3 times daily before meals. Side effects: dry mouth or dizziness. B. Antibiotics. Purpose: treat suspected bacterial overgrowth, SIBO, in the gut. Example: Tab Refagut 550 mg. Dosage: 1 tablet twice daily for 14 days. Side effects: mild nausea or bloating. Long-term use may lead to antibiotic resistance. C. Proton pump inhibitors, PPIs. Purpose: reduce acid reflux associated with IBS. Example: Tab Famalock 20 mg. Dosage: 1 tablet before breakfast once daily. Side effects: rare nutrient deficiencies or headache. D. Laxatives for IBS-C. Examples: psyllium, fiber supplement, polyethylene glycol. Caution: overuse can cause dependency and worsening symptoms. 2. Dietary changes. A. Low FODMAP diet. Avoid fermentable foods that worsen gas and bloating. These include certain fruits, apples, pears, dairy products, and high fructose items. B. Increase soluble fiber. Helps manage constipation but must be introduced gradually. Examples include oats, bananas, and cooked carrots. Or C. Hydration. Drink plenty of water, especially for those with constipation. D. Limit trigger foods. Avoid caffeine, alcohol, fatty foods, and artificial sweeteners. 3. Lifestyle changes. Stress management. Mindfulness-based stress reduction, MBSR, yoga, or deep breathing can alleviate IBS symptoms. Exercise. Regular physical activity promotes digestion and reduces stress. 4. Probiotics. Beneficial bacteria like lactobacillus and bifidobacterium can restore gut balance. Available as supplements or in foods like yogurt with live cultures. 5. Behavioral therapy. Gut-directed cognitive behavioral therapy, CBT, helps in managing the mental aspect of IBS. Complications of IBS. 1. Impact on quality of life. IBS can lead to social and emotional distress due to unpredictable symptoms. 2. Nutritional deficiencies due to dietary restrictions or malabsorption. 3. Overlapping disorders. IBS often coexists with conditions like fibromyalgia or migraines. Part 3 will address jaundice and chronic diseases, their treatments, and elaborate on lifelong conditions managed by antihypertensive drugs. Part 3, understanding jaundice, chronic diseases, and antihypertensive drugs. What is jaundice? Jaundice is a condition where the skin, mucous membranes, and the whites of the eyes develop a yellowish tinge due to an excess of bilirubin in the bloodstream. Bilirubin is a yellow pigment produced during the breakdown of red blood cells and is processed by the liver. When the liver is unable to process or excrete bilirubin efficiently, it accumulates in the blood, leading to jaundice. Causes of jaundice. 1. Viral hepatitis. Infections like hepatitis A, B, C, D, and E cause inflammation of the liver. Spread via hepatitis A and E, contaminated food and water, hepatitis B, C, and D, blood, sexual contact, or from mother to child during birth. 2. Gallstones. Blockage in bile ducts prevents bilirubin from leaving the body. 3. Liver diseases. Conditions such as cirrhosis or fatty liver reduce liver efficiency. 4. Hemolytic anemia. Increased destruction of red blood cells leads to excess bilirubin production. 5. Drug-induced jaundice. Certain medications, like acetaminophen in high doses, can harm the liver. Symptoms of jaundice. 1. Yellowing of skin and eyes. 2. Dark-colored urine. 3. Pale or clay-colored stool due to lack of bile. 4. Fatigue and weakness. 5. Abdominal pain, especially in liver-related cases. Treatment of jaundice. Diagnosis: 1. Serum bilirubin test, normal 0.3 to 1.2 milligrams per dL. Liver function tests, LFTs. 3. Tests for viral hepatitis, anti-AV, HB-Sag, anti-HCV. Treatment based on cause: 1. For viral hepatitis, rest and hydration. Avoid alcohol and liver-toxic drugs. Medications: Tab UDCA 300 milligrams, protects liver cells by reducing bile acid toxicity. Dosage: 1 tablet after meals, 3 times daily. Side effects: nausea or diarrhea in rare cases. Capzoral 20 milligrams reduces inflammation. Dosage: 1 capsule once daily after food. Side effects: gastrointestinal upset. 2. For gallstones, surgery may be required to remove the blockage. 3. For hemolytic causes, treat the underlying cause of red cell breakdown. Lifestyle changes: avoid processed and fried foods. Include papaya and mango, rich in digestive enzymes. Iron-rich foods like almonds or oatmeal if anemia is present. Chronic diseases managed with medications. 1. Diabetes mellitus. Cannot be cured, but can be managed with lifestyle changes, oral medications, or insulin therapy. 2. Hypertension. Requires lifelong antihypertensive medications and lifestyle modifications. 3. Asthma. Chronic inflammatory disease managed with inhalers and bronchodilators. 4. Epilepsy. Seizure activity is controlled with anti-epileptic drugs, AEDs, like carbamazepine. 5. Dyslipidemia. High cholesterol is managed with statins and a healthy diet. Cheshire. Antihypertensive drugs. Chronic high blood pressure, hypertension, is treated with long-term medications to prevent complications like heart attacks or strokes. Common antihypertensive medications. 1. Olmesartan. Purpose: angiotensin receptor blocker that relaxes blood vessels. Dosage: Tab Olmesartan 20 milligrams, 1 tablet at night. Side effects: dizziness, tiredness, or diarrhea. 2. Lasix furosemide. Purpose: diuretic that reduces blood pressure by eliminating excess fluid. Dosage: Tab Lasix 40 milligrams, 1 tablet in the morning. Side effects: increased urination, dehydration, or electrolyte imbalances. Lifelong conditions and their management. 1. Diabetes. Requires blood sugar monitoring. Diet control is critical. 2. Hypertension. Monitor blood pressure regularly. Low-salt diet and stress reduction. Would you like to dive deeper into any of